Lupus is a chronic autoimmune disease where the immune system attacks the body's own tissues. Lupus affects approximately 1.5 million people in the United States and around 5 million people worldwide. Lupus predominantly affects women. Selena Gomez publicly revealed that she had been diagnosed with lupus in October 2015. She actively uses her platform to spread awareness.
Lupus warrior ever since, raising awareness throughout the world. The Lupus Research Alliance knows lupus is very different for each person and many treatments are needed.
Halsey, another famous pop star, recently shared publicly that she was diagnosed with lupus. 90% of women who have lupus are between age 15 and 44. Lupus is more prevalent in people of African, Hispanic, Asian, and Native American descent compared to Caucasians. African American women are 3 times more likely to get lupus than Caucasian women. The butterfly rash is a characteristic rash that appears across the cheeks and nose, resembling the shape of a butterfly. Other common symptoms of lupus are joint pain, organ pain, such as kidney pain, dry eyes, hair loss, and frequent headaches. Lupus can lead to increased risk of miscarriage, preterm birth, and preeclampsia. With careful planning and management, many women with lupus can have healthy pregnancies and babies. One of the most common symptoms of lupus is alopecia. Alopecia is defined by hair loss. There are 2 common types of alopecia: non-scarring alopecia and scarring alopecia. Non-scarring alopecia is also known as diffuse hair thinning. Your hair may become thin and fragile, leading to diffuse hair loss across the scalp. This type of hair loss is usually reversible and can improve as the disease is brought under control. Scarring alopecia results in permanent hair loss. It usually presents as discoid lesions. They are red, scaly patches on the scalp can cause permanent scarring and hair loss in the affected areas. Jada Pinkett Smith is a celebrity that came out publicly about having alopecia. She pointed out a scar on her scalp, explaining what influenced her to have her hair cut. She discussed her struggles with alopecia and brought awareness to the topic on her show Red Table Talk. The exact cause of lupus is not fully understood, but it is believed to result from a combination of genetic, environmental triggers, hormonal, and immune system factors. Although we don't know the exact cause of lupus, some key factors to focus on are family history, infections, medications, stress, smoking, and diet. Diagnosing lupus can be challenging because its symptoms often mimic those of other diseases. Symptoms can vary widely among individuals. On average, it takes nearly 6 years for people with lupus to be diagnosed from the time they first notice their symptoms. Since there is no single test to diagnose lupus, this adds to the challenge of healthcare providers making a diagnosis. Healthcare providers use a number of laboratory tests to help with diagnosis. Here are the key lab tests used in diagnosing lupus: anti-nuclear antibody test, specific autoantibody tests, complete blood count, erythrocyte sedimentation rate, C-reactive protein, complement levels C3 and C4, and urinalysis. Treatment for lupus is individualized and focuses on managing symptoms, reducing inflammation, and preventing flares and organ damage. Treatment involves using medications or lifestyle changes, or both. Medications may be needed for severe disease, but if you are in the early stages, you can minimize progression of the disease and keep it under control. Key factors to managing lupus with lifestyle changes are reducing emotional stress, which reduces your cortisol levels, decrease inflammation through diet, and exercise, which reduces cortisol levels. Adhering to these lifestyle changes on a continual basis will significantly improve symptoms.